and welcome to the special interview where we will be talking about how important genome sequencing is. Joining us today is a very special guest, Dr. Rakesh Mishra. He's Director, Tata Institute for Genetics and Society, and former Director of Council of Scientific and Industrial Research Center for Cellular and Molecular Biology. Thank you so much, Dr. Mishra, for joining us today.
Thank you.
The first thing I think which all our viewers would want to know is that we are in the third year of the COVID-19 pandemic and new variants of this virus just keep emerging. Fatigue has obviously set in. So for better understanding of our viewers, is it something unique of the SARS-CoV-2 that it is mutating so much and we have new variants every now and then?
See, the SARS, there are several such viruses already known,
Yes.
and many of them cause disease, they are infectious. So there is nothing unusual about this particular virus as far as this family of viruses is concerned. And mutation in these viruses is the very crucial component of their survival strategy. So that is how they acquire new characters, evade immune system, because they have to find the host again and again. If they don't do that, then they will be eliminated. So that is very normal. And that's what this virus is doing. This virus does not have mutational features which are very unusual or more efficient than other similar viruses that are known.
Okay.
So, and new variants will keep coming because, as I said, there's selection pressure on the virus. Once we get infected, we develop immunity. Then virus will try to reinfect. At that time, it has to fight the immunity that we have gained, whether it is by natural infection or by, in this case, even vaccination. And the other thing viruses always are competing with others is to infect as many people as possible. In that, this virus has acquired quite a bit that is very, very infectious. So the new variants will be more infectious because that is why they will come into existence. Otherwise, they will not be able to compete. So there is a very natural process which is expected from such viruses, what this is doing as well.
So like you just said, coronavirus has happened in the past, be it the SARS outbreak in 2002 or the MERS outbreak in 2012. How is this pandemic different from the previous outbreaks?
There are a couple of things which make this virus unique. One is our behavior. Compared to 20 years ago, our planet has become smaller in terms of people reaching one place to other. So when we travel, we also carry things like infection. The second thing is this virus is far more infectious than earlier SARS or MERS is tenfold or even more infectious than those. And that's what has given this virus advantages. Luckily, it's not as lethal as SARS and MERS because they were much more dangerous. So if this kind of infection happened that time, that would have wiped out a huge number. So this is less dangerous in terms of mortality, but is extremely infectious. Probably, more infectious than these are than only the measles and or something like common cold of a similar category. Otherwise, so that's what has led to the what we have observed as a pandemic because it spread so fast. You have seen in November sometime we found that there's a variant called Omicron in African countries, and within 4 or 5 weeks we have shared the air and everybody all world there was Omicron. So that fast is the spread of this virus. So that has given this advantage.
So the spread, Dr. Mishra, how were the earlier outbreaks curtailed, and why are we still really struggling to put an end to the COVID-19 pandemic? This is also when we have so many vaccines, and the vaccines have been developed in record time. So this was not the case earlier. So do you think it's because, again, the way it's spreading because of the infectiousness of the disease?
Exactly. Yeah. So when a virus becomes infectious, it has many advantages because this is able to present newer and newer variants faster, because variants will come only when the virus infects another individual and creates new mutations. Most of them will be not useful for the virus, so they disappear, but few that are more infectious, they survive and they start to dominate in the population.
Sure.
And since this is being infectious, one infected person can infect 10 other infected people. while MERS and SARS will infect maybe one or two. So that means that you can imagine there's a chain reaction.
Yeah.
So earlier ones were not so infectious. Once people realized, very little care just terminated the chain, and one of them is disappeared and other one once in a while keep coming.
Yeah.
But this one, because of its infectiousness, is spread fast, and newer variants also express themselves, or they spread far more with larger speed.
Okay.
As you mentioned, we have vaccine now, so we should be able to control that, and that's what actually has happened. The vaccines have saved millions of lives. So what is happening is that vaccines are not able to prevent the infection. They are able to prevent the seriousness of the disease. So people may get infected, but our immunity defense and virus is not able to cause much damage. Although to some degree it will prevent the infection in the beginning of the infection as well. But since the virus spreads fast, more variants come. Then before our body gets prepared, the new variants starts to attack, and that's why like Omicron spread so fast. Although most people had prior immunity of one kind or other, but this was able to break through that immunity and spread. But luckily, as I said, because of the prior protection, those who were either infected or were vaccinated did not suffer much from Omicron, but others did suffer a lot. Many countries, lots of deaths because of Omicron, where there were no vaccination or less infection prior to.
So vaccination definitely, I think, is key.
Absolutely.
And of course, like all COVID protocols are still important, from wearing a mask to maintaining social distancing. Moving on, Dr. Mishra, something which we want to know about is, just for our viewers, a very, very basic question. What is genome sequencing and what role does it play in disease outbreaks or its prevention?
So genome is the genetic material of all living beings. Like we are unique, or what we are, because of our genome. So this virus genome is in form of RNA. Most of the other organisms have DNA as their genetic material. And the complete sequencing, that means reading the complete detail of this genome, is called genome sequencing, because that's essentially the chemical units that make the genome. We decipher by using some technology and machines. So we know exactly what those 30,000 letters in this virus are. So now, since the virus is changing, a change virus then infects, and then new chains are added and so on. So we can actually plot the relationship between one infection to other, the way we can plot the relationship among individuals, parents and their children and their grandparents and so on, by just reading their DNA sequence. Similarly, by reading the genome of the virus, we can actually connect the relatedness of this virus, same virus with different variants, and find out how it is spreading, which are the path, whether it went first to Bombay, then to Delhi, then to Kolkata, so on. So we can actually figure out if we do in detailed way. Second thing is, as the virus is changing, new and new variations are coming, and some of them will be more harmful, some of them may be less harmful. So suddenly, if we see people are falling sick more than previous, so or suddenly there is more infection than earlier, so we wonder whether a new variant has come, or people have done partying and marriage dinner, and that is why it has spread. So if you go and sequence, you will immediately know. So for example, now we know the recent increase in cases is not because of new variant. It is because of the activity of the people. But when we see that cases are increased and we see this new variant, then we know we have to take additional precaution. New bug has come around. And the third thing which genome sequencing does is the finding the target of the virus, which can be used for the drug and of course the vaccine. Why vaccine came so fast? Because the moment the virus infection was identified, its sequence was made available, and within weeks people started working on the vaccine. And there was some prior lead because of the vaccination that was tried with the earlier SARS virus. So same thing was adopted, and the vaccines did become available extremely fast. Like it was like magic. None of us were expecting so many vaccines will become available, and they have been really helpful in fighting this
disease. Yes. Again, in terms of genome sequencing, how big are India's capabilities compared to other countries in the world, and what kind of infrastructure does India have for genome sequencing?
So genome sequence capability is reasonable in our country, particularly for sequencing the genome of the SARS-CoV-2. It's actually trivial in terms of if you think of the technology and capacity that we have. We have tremendous capacity for this. Of course, there are countries like UK and all, they are far ahead of us, even they are smaller countries in terms of genome capacity. But sequencing the SARS-CoV-2 genome is not really, capacity is not an issue. We have a lot of that. There are many places, 10, 12 places where you can do very, very high throughput. You can sequence thousands and thousands in each day. But there are hundreds of other centers where you can do small scale sequencing, which is reasonable and what is actually desired in that detail. So we have capacity. Only thing we do not have is that we need to import the chemicals, the consumables that are used to run those machines. We have machines. Once you buy the machine, then it is there. But the consumables that are used, they are imported, and that costs money. And sometimes if you could make our own, that will become cheaper. So for example, these days, each sequencing will cost a few thousand, maybe 3,000-4,000. Depending upon which machine you are using, what is the throughput you are using, it may cost a couple of thousand or it may cost 5,000-6,000. But if we could make our own reagent, it may go down maybe even tenfold.
The cost reduction. Okay, again, another thing, prior to the pandemic, I think this is something a lot of people would want to know. What all was India using genome sequencing for, and how was it driving policy decisions?
So earlier we were interested in so much of genome sequencing for the people. As you know, even the CSIR's lab, CCMB in Hyderabad has been using, and IGIB in Delhi have been using extremely extensively human genome sequencing approaches for a variety of reasons. For example, studies in CCMB showed that 70,000 years ago, Andamanese people came from Africa, following the western coast and then tip of the country, and then using water ways to reach Andaman Nicobar. That was established because of the genome sequencing. You compare the genomes of those people and relate. This way we could figure out how the Indian subcontinent was populated in two waves and so on. Also, India has extremely rich variety in the people in different ethnic groups. We have 5,000 or so ethnic groups, and we can distinguish them not only by their features but also by genetic means. And nowadays, genome sequencing is becoming extremely useful in deciding what kind of disease we might get, what kind of treatment we should get, particularly, for example, cancer or psychiatric diseases. 50% or more number of times drugs don't work for the individual of a particular genetic makeup. So if we carefully collect information, then we can tell which drug will be useful for which person, and we can avoid unnecessary treatment and also the toxicity and other discomfort that person goes through without getting any benefit of those treatment. And of course, lots of cattle and crop genomes were sequenced for obvious reason that people want to improve the variety, understand what are the genetic features that determine their character, and a lot of microbiome genome was also being sequenced. So those were mainly for following a particular biology question or some application that we want to make by genome editing or understanding the genome. And as I said, for humans of disease and understanding the genetic variations that we have. But
so, I mean, that was before the pandemic. How much do you think in our country has genome sequencing evolved since the COVID-19 outbreak?
So the genome sequencing, we don't need to evolve much. Technology is already in place. It's just that more and more labs have started using it. So that is a good thing that has happened. There are smaller machines which are, like a very high throughput machine may cost 8-9 crores to set that up. But there are machines that can cost a lakh or two. They will do very low throughput sequencing, but you can use them at very remote places. They don't require much setup. So that has increased a lot. I guess more than 100 or so places you can do genome sequencing. That is very good thing, because you need locally such capacities to be established.
Yeah.
And also people have learned more that the idea that genome sequencing can be useful. As I mentioned, you can use it for drug development, for vaccine development, understand, and
Its importance as well.
surveillance is important has come. Never before in the history we have used genome sequencing so much to understand and use it for surveillance purposes and relate. So, for example, if some places, why some people fall sick and some don't fall sick, whether they are themselves more susceptible or they are infected by different variants. When do sequencing, then we can figure out what is the reason and take appropriate action.
Dr. Mishra, the other thing, how is whole genome sequencing as an epidemiological tool helped India fight the pandemic?
So there are, I mean, this has been useful in the sense that we are confident whether for example, in current situation when we speak today, we know the cases that are increasing are because of new variant or because of the human behavior. So this gives us, now you may have seen that some states have already started urging people to wear masks. Earlier they said, okay, mask is not necessary. So they know that if we change our behavior, we will control. But if it was a different variant, then we have to think of more strict measures, whether we should do a partial restrictions and travel restrictions and so on. So I can give you one example. For example, when the UK variant came, which is called Alpha variant, then there was government made a rule that whoever comes from UK or abroad airports, they should be tested, and they are positive, it should be figured out whether they have alpha or something else. So we were doing in Hyderabad with the cooperation of the municipal corporation, local government, and Hyderabad airport. And each person who was tested positive, we will do the sequencing, and within a couple of days we know which one is whether it's and we identified many variants. And they were then put for 14 days quarantine. And in south of India, alpha variant did not enter because Hyderabad is a major airport, and we were able to prevent that. While in Delhi did not happen, whether we did sequencing or these people managed somehow to escape, and alpha came. And that has actually begun the second wave, and later, of course, Delta emerged. And again, we figured out there's a new variant in Maharashtra that is increasing the infectivity and even the symptom of the people. Virus load is more. And it turned out that it has a new mutations. And that was, if you remember, was called double mutant or Indian variants. Later it became Delta when the proper nomenclature was done. And so once we know that new variant is coming, in some places it's emerging, then we have to see the information is only as useful as you use it. Otherwise, it's just in the closed computers or files. So sharing the information as soon as possible with as many large scale as possible is the key thing. We should not be afraid of sharing the information. If we are not sharing the information, after some time, it's actually useless. It's just another.
So sharing information is key. And I think rightly what you said, that genome sequencing is definitely helped, to understand the pandemic better. And like what you said, I mean, once you share the experience, a lot can be gained out of that knowledge. Dr. Mishra, what percentage of the samples being tested for COVID-19 are being genome sequenced? And is it as per any established international benchmark?
So I think when during the peak of the waves, like even this second wave, we didn't have so much of capacity. Although I mean capacity we had, but we were not sequencing so much. And then the INSACOG and these things were done, and in an organized way with a proper strategy, sequencing was started. But even during the third wave peak, we were sequencing quite a bit, which was reasonable. The one criteria we can say that we have sequenced enough is that we have not caught off guard that a new variant came in large number and we did not pick it early on. So each time, even Omicron, when it came in Bangalore, we picked very early in a visitor, and then as soon as it started to spread, we were knowing what proportion of this is spreading, and then slowly it actually replaced Delta completely. So using those, the one thing is to go by numbers. When you are having several lakh cases per day, you can't sequence even 1% because that's a very large number.
Yeah.
But nowadays, when the cases are low, we tend to become a little bit relaxed. Now we think that there is no much problem now. And this is the time actually we should be sequencing more. Because now, wherever we find a new variant, we should focus there and uh, choke the virus wherever it's emerging, rather than when it spreads many places, then it's out of control.
I think
And
that's a very important point which you
exactly.
pointed out.
And if we see somewhere people are falling more sick, go and see every person who comes to hospital with COVID infection must be sequenced. Because why this person landed in the hospital, although most people are asymptomatic or they don't need hospital care.
True.
So maybe person may have comorbidity. Okay, so we will know that, but maybe it is a new variant. If new variant, then we have to take precautions, and those are the things we should be more careful. So we have capacity, we have now know how to handle this data. It's just that the planning of proper strategy, having proper strategy to sequencing is, and its implementation, of course, is something which we should not relax. We should keep pushing and be careful.
So we do know, of course, you've told us the importance and, how we can be used, and implementation, of course, is key. With variants emerging constantly, Dr. Mishra, how important is it to scale up our genome sequencing capability to fight this pandemic? And are there any major challenges you would like to share with us, any roadblocks to such expansion of capabilities if needed?
So as I said, the capabilities we have, and there has been expansion of the small scale sequencing centers in remote places, because if you don't do there, then you have to bring the sample, and with some flight or something, it may take additional day or two. And locally doing something and sharing the result with local bodies is important. So I'm not so much worried about the capacity. We have actually enough capacity. As I said, the sequencing of this virus is trivial in terms of genomics, because it's very small genome compared to when we sequence humans or other plants or animals. What is challenging is to have a proper sample collection strategy. We are a large country, so we have to collect samples from every district at least once in a week, or with some whatever is a affordable strategy, and make sure that why randomized geographical locations are covered on a regular basis, so that if a new variant comes, we catch it soon. The other strategy, as I said, that all the hospitalized patients should be sequenced. So anytime, because even if virus is more infectious, it is still okay. But if it is more dangerous in terms of disease and symptoms leading to hospitalization, that's the problem that we have to very keenly watch for those variants and prevent them from spreading. And only correlating the infection with the genome sequence will tell us whether new variant is causing this or some other reason, and then take appropriate.
Thank you for putting that really well. Just the last few questions. What are some of the big learnings, Dr. Mishra, you feel that from this pandemic?
Oh, so pandemic has taught us many things. The way we work, we are not going to work the same way now. Work from home and many other things, like we are having interview like this, that was not that common before, and now we are using it for our professional purposes on a regular basis.
Yes.
So, and the second thing, we have realized how important infectious diseases are, and being developed country is not enough. Maximum damage has happened. People now, if you consider number of people dying, it is the one of the most powerful country, right? USA. So that means the infectious diseases are important for us to take care. Second thing, we have seen that although we say we are a civilized world, but if one country has 4 doses of vaccine and entire continent is not having even a single dose, is a shame for the humanity. And it's not only even safe for the humanity, because that means virus will be playing the places where there are unprotected people, and it will come back to everybody. So vaccination has to be covered. The vaccine equity is extremely important. And to me, the most important thing is that that we should realize that this planet belongs to all creatures. It doesn't only belong to people. All the pandemics come from the wild, because we go and encroach the wild. We disturb them. We eat them while we have not grown them in our farms or our fields. So that's we have to learn to live within the scope of resources. And healthcare system needs extra. I mean, so many people died in the second wave because of the crowding in the hospitals. So what are the ways we can prevent them from happening? Next pandemic will come. The way we are developing, so-called developing, the way we are disturbing the wildlife, global changes happening. We are very closely interacting with the wild ecosystem.
Yeah.
Therefore, it is likely that pandemics will come. So we should be prepared. We should do constant surveillance, which is very, very important. If we don't do that, we will be inviting trouble for us.
I think many learnings, and I think it's important that we, take something from the learnings. I think, and what you rightly said, Dr. Mishra, it's important that we respect our environment. It's not just for humans. I think that's the key takeaway. Thank you so much, Dr. Mishra, for joining us and sharing your expertise with our viewers. Thank you so much.
You're welcome. Thank you.